It's clear the toll of this pandemic on the economy is devastating. So much so that even hospitals are feeling the strain. Hundreds of hospital staff have been furloughed across Tennessee. News Channel 5's Chris Davis shows us why this trend could impact hospitals both large and small.
I broke my pinky finger, my little one, really close to the hand.
Some things you just don't see coming.
I ended up hitting it with my foot and face planting.
But for Rain Counts, time was on her side.
It was either, kind of doing surgery then or waiting till about now to see if the hand was repairing itself.
She chose to do the surgery right away. Then just days later, procedures like hers were canceled because of COVID-19. It's a different world because of COVID-19. Normally, this parking lot would be full of patients ready for treatment, but because elective surgeries have been canceled, that's not the case anymore. And for some medical centers across the state, staff parking is also a little emptier as well.
The challenges around treating COVID patients, it's all hands on deck.
All hands on deck if you specialize in infectious diseases or are a nurse. But for other hospital staff,
you could keep them on payroll, but you basically would be keeping them on payroll but not using them.
Dr. Timothy McBride, a health economics professor at Washington University in St. Louis, says that's why you see hospitals like Cookeville Regional, Murray Regional, and Williamson Medical furloughing or laying off staff.
All hospital business is a business that operates with a pretty small margin.
A thin margin that has become even thinner because elective surgeries are canceled, and then keep in mind, Tennessee is one of many states that haven't expanded Medicaid.
That's going to take your 1% margin and make it negative 1%.
And as unemployment continues to grow, that means more patients are coming in without insurance.
You might not get reimbursed for that. You could take even a hospital that's got a positive margin and make it even more negative.
Go ahead and get it done.
Much like Rain, the state of Tennessee couldn't have seen this coming. The question is, do hospitals have time on their side?
We haven't really prepared for something like this.
Chris Davis, News Channel 5.
That expert also says it costs hospitals 20% more on average to treat a person with COVID-19 than a regular patient in the ICU.